give my 2 cents on this discussion, because I found it very intriguing, is that it's very simple. We always one decision away from having a completely different life. It's your decision, whether it's less screen time or changing your diet. It is a simple decision that only you can make, and that will lead you to a completely different lifestyle, yeah? You can decide, all right, I'm gonna pack up my things, I'm gonna go live in another country. That'll change your life forever. All right, so moving on, continuing our journey of innovation, our next session, a keynote on pioneering deep health, building the metabolic digital twin for precision medicine. Our esteemed speaker and bronze sponsor, Dr. Ali Tinazli, CEO of Lifespin GmbH, will explore how creating digital metabolic twins has the potential to revolutionize precision medicine, thus enhancing patient care and medical accuracy. Please put your hands together for Dr. Tinazli. Thank you, sir.
Hello,
yes, you have everything you need.
I think I need
you want a handheld?
Yeah, that's I think better. Okay, thank you. Hello, good morning, everyone. It's a great pleasure being here again, like almost every month. Okay, so I'll be speaking about hopefully useful things. The purpose is not to talk about tech gimmicks. The purpose is about doing truly useful things. So I'll be speaking about deep health. We coined the term deep health because it's a combination of precision medicine, big data, data science, AI, and we are using a new clinical modality, and I will some interesting insights, and I'll be speaking about pizza. That's very important. Now, first, when I speak to physicians, I always like to talk about the stethoscope because physicians love this 150-year-old device. They still use it. The reason why the stethoscope is so powerful is it's disease agnostic and hypothesis free. You learn at med school how a healthy heart and a healthy lung sound like. That means you approach your patient, listen to the patient. If the patient sounds normal, all good. If the patient doesn't sound normal, then you need to do further testing, obviously. So the stethoscope is very popular because physicians can use it on every patient again and again. But it's very old technology and somehow doesn't feel right these days. So we are working basically on a stethoscope which is metabolomic, based on deep health. That's what I'll be talking about, because physicians are used to see disease and physicians are used to qualify if a treatment works or not. The same thing we do, but in a much more sophisticated and, let's say, precise, personalized fashion. So digital health is over for it's going on in the news for the past 15 years, I would say. Everyone has a different understanding of digital health. In some countries, just a digital insurance card is digital health. On the other extreme, you can speak about very sophisticated, let's say, methods which are truly digital. But important is that we get more and more people living on this planet, and we also have to acknowledge that more than half of the population does not have access to proper healthcare. People who have access to healthcare have to pay a lot, and the outcome, I would say, is mediocre in general. And we have to change that because the rate of chronic diseases, basically we can summarize this as non-communicable diseases, including cancer, is skyrocketing. So we have to do something about it, otherwise it will be quite how shall I say, ugly scenario. The good news is we are in the age of technology convergence. Technology progress is happening faster than ever. You see here some of the first commercial electronics from HP from the 1960s. You see the emergence of microfluidics from the 1980s, 1990s, and then you see big data, which we are observing now for the past 20 years. Now, when you translate this into healthcare, what does that mean? It means it's the convergence of biology and data. Basically, healthcare in the very early days of humanity was actually highly personalized, but not really precise, I would say, and the access was somewhat exclusive. Then during the Renaissance, medicine became more of a scientific discipline, right? That's the foundation of the modern medicine, but still access was limited. Then after World War II, we have seen an industrialization and standardization of healthcare, which was great to make sure that we speak about apples and apples, that we compare apples to apples. But it's getting not really, how shall I say, it's not scalable really, and it's not sustainable. So we have to use new tools from data science to basically have a better accessible, better affordable healthcare. And AI can reduce costs in healthcare. That's really important. So it's not a gimmick. It's really about how to make better care available, accessible for more people. Now I'll be speaking about what we are doing at Lifespin. So we turn analog blood, basically the traditional blood sample, into digital blood. And when you digitize blood, you can interrogate blood with algorithms. Then you can do all the things which you typically do in a lab with in silico methods. And we are working basically on a proactive, precise, continuous healthcare for all. And we are basically a company based in Regensburg, Germany, and we are combining advanced measurement technologies with AI. And our positioning is basically we want to establish AI-based tools to improve healthcare provider efficiency and outcomes. And so basically, the mission is to drive a deep health approach to global healthcare by creating a digital twins based on metabolomic profiles for prevention, diagnosis, and treatment. Now, let's speak about metabolism. So when we eat something, when we digest something, we have plenty of chemical reactions. That's what we call metabolism. And you study medicine or biochemistry, you learn all this. Metabolites are the small chemical molecules. And this basically, in its sum, is called the metabolome. What's interesting is, up to until last year, it was hard to hear the term metabolome in a clinical setting. Since last year, I hear more and more frequently that innovative healthcare systems are speaking about metabolomics. And I will show you now why it's important. When you look at the metabolome, you have basically information access, which enables you to use this information for prevention, diagnosis, and improvement of treatments. So basically, prevention is important to avoid the onset of disease. That's especially interesting for high-risk groups, which are elderly people, but not limited to. Diagnosis of complex diseases, for example, at the onset of neurological or oncological diseases, the symptoms are very unspecific. That's why physicians need typically half a year or more to diagnose a complex disease. But then you lose precious time. It's also very costly. Quality of life of the patient goes down. Treatment, and it doesn't need to be just the dramatic cancer case. All sort of treatments, at the end of the day, need to be personalized because you always want to know, does the medication you take really work on your body? Now, we are working basically on a health information system which is based on the combination of an advanced measurement technology called NMR and AI to transform metabolomics into an affordable tool to democratize precision medicine and enable population-wide screening. Just to do a level set of what metabolome and metabolism is, we all are now acquainted with genomics. So the genomics revolution taking place in the past 30 years, I would say, enlightened us quite a bit in healthcare. Now you hear quite a bit also about, and the genome just tells you what could happen, right? What may happen. When you look at the transcriptome, then you see of what should happen. You still don't know if it's really happening. When you look at the proteome, at the proteins, you see how much is happening of what. But still there is some ambiguity because in the case of proteins, depends also where they exactly are in the cellular system. Ultimately, the real status of what is happening you can only get from the metabolome. It's basically a real-time health status mirror. This information you get from the metabolome, you can basically use now for preventative care, for disease diagnosis or monitoring and treatment. So basically, it's a continuum of use cases in healthcare. And what's really encouraging is that now leading innovative hospitals are recognizing this and are starting to establish metabolomics in the clinic complementary to genomics. Now, it's just a quick summary of what we are doing. So we basically have a cyber-physical system. We turn liquid blood, analog blood into digital blood, and then we basically use NMR to get hundreds of metabolites in a blood sample quantitatively. Then we match this with our proprietary digital biobank, where we have more than 230,000 patient profiles, and with about 700 diseases. And then we basically do everything you would do in a traditional lab just in silico without the need for expensive chemical reagents. And what's really important is to get also this backing, I would say, from the scientific aspect. So basically, one of our board members, Jim Rothman, Nobel laureate 2013 medicine, he confirms our thesis that almost all diseases are linked to metabolism. That means when you have an analytical window into metabolism, then you basically have immediate access to the health status information. And right now we have about, in our database, 700 diseases based on ICD-10 codes. We have more than 230,000 patient profiles. And so basically, we use this now to generate the digital twin. We take the patient's blood, generate the digital twin of the patient, then we compare this against hundreds of thousands of people. So basically, if you ask me, what do we with the AI? We compare people, very basic. Here's a quick movie to show how we are actually operating. Do we have audio on the video?
5 milliliters of blood and takes only one measurement for all tests. The NMR instrument is the interface between the physical and digital world. The patient's metabolic information is being captured in one single scan with radio frequencies and compared to billions of data points from individual metabolic profiles within moments. The sample partitioning for accessing biomarkers and performing health tests is based solely on algorithms. Lifespin. Take your health in your hands.
So as you've seen, the workflow is truly simple. You basically take a small blood sample, venous blood, that's very important, it's systemic blood, and then you digitize it in an NMR-equipped laboratory. Once the results are online, we process it in our cloud, where we basically do the entire processing, the digital twin generation with the combination of the patient's meta information. Then we do the automated in silico health assessment, and this takes only a couple of minutes, just as fast as software typically works, right? So then you get basically different types of health reports depending on the use cases you're addressing. So depending if you do treatment monitoring of a cancer patient, or differential diagnosis in neurology, or preventative care for elderly people, for example. Now you may ask, okay, sounds all great, but how accurate does it really work? Because when I speak about precision medicine system, then the most substantial foundation is that the measurements, the quantitative capture is really accurate, and that's what we have done. So we have done a round-robin testing with more than 500 clinical labs in Germany, and you will see the red dot are our results, where basically, just as a summary, top performing, the quantitative measurement is basically extremely precise. So what we get is the physics. We don't need chemistry. That's the beauty of it. Physics is always precise. Chemistry has always some flaws based on diffusion and other effects. That's why we have this high precision, which is the prerequisite. But now let's jump gears and think about what do we do with that. So here you see what we call a health compass on different types of patient. You can obviously see that a healthy person has all the parameters quantitatively in the healthy range. That's all good, but you also see how kidney failure looks like, you see how obesity looks like, or stroke. Now let's dive into stroke, because here basically we enter the world of neurology, which is an extremely tough world because, I mean, our system can differentiate, discriminate among different diseases. Now, to discriminate between healthy and stroke is very easy, right? Even a child can do that. So the AUC value is fairly high at 0.98. But then multiple sclerosis versus stroke, it's getting somewhat interesting. Again, we can differentiate it. And then migraine versus stroke, quite a few women who actually suffer from a stroke are being misdiagnosed with migraine because physicians sometimes seem to have a stereotypical thinking. That's why it's very important to be able to differentiate migraine or to discriminate migraine from stroke. What's also interesting is Parkinson's disease from stroke. I was always wondering why my team has done the study with the Charité Hospital and looking at Parkinson versus stroke. Parkinson first year is very similar, just looks like stroke. It's very interesting. But we can see that actually it's really different. What exactly are we seeing? Don't worry, your eyes are perfectly fine. I just blur this for IP reasons. You see basically a list of metabolites which show a disease-specific change. This is the signature of disease, and we have these type of signatures for many, many diseases. But now let's go now to my favorite part. Now you've seen what we basically do with this system, and how much would you say does it cost to digitize one patient and to do all this analysis? Please throw some numbers. Shout it out. Any numbers? That's too ambitious, but it's the right ballpark. It's basically less than a pizza margarita, I totally agree. So that's a pizza I had in Hong Kong a few months ago, but it was really around this price. So basically, it cost about less than $10 to digitize one patient profile, and that's very important. And I'm always very open with the cost structure because my point is not to make this into an extremely expensive method like liquid biopsy based on genomics. The objective here is to incorporate this as part of a triage solution in hospital practice. So my interest is not to sell a Rolls Royce, my interest is to sell a Toyota. It should be affordable for everyone, that's very important. Now, our business model is basically to work with healthcare providers and laboratories. So basically, our business is to enable partner laboratories to obtain these patient samples in a digital format. We then generate the precision health information, and that's basically how we make our money. That's very important to be clear about the business model. It's basically about health information. Or here just easy to show, with a healthcare partner which provides the blood or the raw data, then we turn this into digital blood, we generate the digital twin, deliver the health information to the healthcare partner and get paid for. The beauty of it is, once you have a patient sample digitized, you cannot only use it for one specific test. First of all, you can use it for the entire metabolome. That means you get a 360 degrees view of the patient's health. Second, you can look, is anything out of range? Is it perhaps a suspicion for cancer or neurological disease? Then you can dive deeper. That means once a patient sample is digitized, you can do as many tests as you want. It's just like an in-app purchase on your phone. And the beauty of it is, it's over the cloud. It's basically software as a service. That's why I'm traveling quite a bit. I've been to many countries in the past months, basically identifying laboratory and hospital partners who share the vision and are ready to basically take on the new clinical modality. Now, you all know, I guess, Audi and BMW. So that's where we're coming from regionally. So we are based in Bavaria, and we have succeeded now to land quite a few partnerships in these locations, predominantly Asia Pacific. US is a bit an interesting topic because the FDA is very much hesitant with AI-based solutions. That's why we focus first on the Asia-Pacific region. Now, it's important to understand what we are doing. What we have is basically a decision support system. And I just skipped this slide and just go immediately to the outlook, because what we are aiming for is basically as an end game to build an omni-intelligent health system which can recognize disease. Right now, we have on our platform about 700 diseases, so we can recognize about 700 and diagnose quite a few already at a good level of accuracy compared to standard benchmarks in the clinic. We are constantly increasing our database and increase the data points. The data points are not just only concentration information, these are the correlations which are important to understand the biochemical pathways as a cause of disease. So our end game is basically to build a Lifespin deep health AI, which is an omni-intelligent system being able to recognize all types of diseases, all the rare diseases. Now, as you can also see, Metabolic is really taking on nicely. So we have seen the success of genomics, but now we have, I think, even faster adoption cycles in the clinic to basically mature and get commoditized. That's basically our objective here. And you all may be familiar with the company Grail. What Grail achieved in genomics is amazing, having software as a service as a new product category and having a pan-cancer test. We are basically aiming not only for a pan-cancer test, we're aiming for a pan-disease test, right? That means the populations we can speak to, given the cost structure and the scalability, is realistically achievable. It will take a couple of years, just as healthcare is, but we are extremely bullish about our outlook. The beauty of health information is it matters to everyone in all types of life settings. That's the beauty of it. That means ultimately health information is one of the most precious assets. Actually, health information is even more valuable than financial information. And if we take this in mind and think of our data play in healthcare, then basically you see clearly that we have basically a clear positioning when it comes to the data. It's really all about the data because this then you can use downstream in different verticals. Just here's an overview of our numerous clinical partners, but thank you very much. It was a great pleasure to introduce you to Lifespin, and feel free to reach out to me. You can actually find my WhatsApp here, so you can just scan the QR code and reach out to me. Thank you very much.
Thank you so much, Dr. Tinazli. Thank you very much.